Hello, good afternoon. This is Dr. Do again. This is a special edition for the quarantine time. This video number 2. On the previous video, we talked about the metabolic syndrome. I start from the obesity and introduced some basic idea for the body mass index to measure the obesity and also the circumferences of the waist. What is the impact for later age? Older than 50 years old. Today I'm just going to briefly talk about the losing weight, how to manage weight. Like I said, take this is a good opportunity, quarantine time at home, not heavy physical activities, so you can take, if you're ready, you can take this time to lose weight, to realize your dream. Okay, it was my dream before, so I worked hard. I lost some weight. Okay, so how to lose weight? There, exercise, diet, without hesitation. You know this. Okay, exercises prevent you to gain weight. It really does not lose weight if you continue overtake calories. So the losing weight part is basically really relies on limited calorie intake. We talked last time, limited to 1800 kilocalories a day is meet the basic metabolic needs. Okay, I think during this time you can, if you BMI about 30, you can do it. Not do it too sudden. Okay, so you limit your calorie intake, and in between you can fill with the fluid. Either any fluid, just low sugar. You can use just water or your homemade solution if you like to. I recommend use 2 or 2.5 liter boiled water with a little bit of lime or lemon and just 1 teaspoon or 1 tablespoon of sugar, brown sugar or honey. Or you can add just fruit, 1 slice of apple, 1 slice of orange, couple pieces, probably 1/3 or a quarter of bananas boiled together, and you drink it break down in between the meals. So this will give you satisfaction and maintain your energy level. And we all know that life starts from water. And if you recall the cerebral patient, or after the especially abdominal surgery, they do not take solid food. The major energy or the major maintenance for life is fluid. So taking that idea, we use it here. You cut your solid food gradually and you fill in with those fluid to maintain your function level. Okay. In terms of how to cut your the meal, I would recommend cut probably gradually. 2/3 of your regular meal amount. Start for a couple of weeks. Okay. Especially the dinner. Okay, so then 2 weeks later, you further cut it, okay, to the half of your regular amount, and then keep doing that probably to the quarter of your regular amount, and then 1/6, just gradually tapering it down. You get used to it, your body gets used to it. In case you still need to carry on very important task, this won't affect your brain function level. So you at the same time you maintain your exercise schedule, as we mentioned, 30 to 40 minutes every day, 5 days a week or 7 days a week. So this will give you a healthy way to lose weight. Or you can talk to your physician, ask recommendations from them. They probably will prescribe medication for you. I'm sure that works in more efficient way, and supervised by your physician is also going to benefit for you. Or you can take the over-counter medication, like we mentioned. It's called ALLI, ALLI. You can use that, follow the instruction, cooperate with your food, limit food calories, and you exercise and add the fluid. So this is how I recommend to lose weight. Actually, this is how I did for myself to lose about 30 pounds. And that's quite an effort to lose those more than 30 pounds. Okay. the other important number we mentioned about the waist circumferences last time, I'd like to talk about the impact of that number. What does it mean? What the impact on the general health? So when you're young, your body mass made by the muscles very healthy. It doesn't matter. But when you're getting older, for example, 50 years old, your waist circumference is about 40. That means you have adipose tissue deposited in the abdomen, which study has shown that male and female has different adipose tissue distribution, which means male has the more fat tissue around the abdomen, increased waist circumferences, which has the increased risk for cardiac disease, ischemic or heart attack. Female, however, the adipose tissue is not distributed in the abdomen, in the limb or in the other area, so that gives the lower risk for female to have the, compared to the same age of male, female has less risk for cardiac attack, heart attack. So that's why we try to get this number down. Okay. For the Western people, Caucasian, Hispanic, or African American, the cutoff line for male is 40 inches. Okay, so if you're about 40 inches, you're really, and especially if you're older than 50 years old, please really consider this to lose weight. And for female, either Caucasian, Hispanic, or African American, no later than 35. Okay, if you have the waist circumferences bigger than 35, I also recommend you please consider to lose it. Okay, it's a benefit for your health, it's cost effective, and really save lives. And for the Asian, there's a different number. Okay, for male it's 35, female is 30, 31. So if you're Asian and you have the number above those, I also recommend you to lose weight. Okay, so next video we'll continue with this metabolic syndrome. I'm going to start with the hypertension. What does it mean? What is the impact for life? How to maintain a good blood pressure. Okay, I'll see you next time.